Okay, thank you everybody for joining us. We'll go ahead and get started with today's Quad Cities COVID-19 Coalition. Today is Tuesday, July 21st. With us, we have Ed Rivers, Director of the Scott County Health Department. We also have Janet Hill with the Rock Island County Health Department. And we have Dr. Lewis Katz, Medical Director of the Scott County Health Department with us today. Each of the speakers will have short prepared information, and then we will go to a question and answer time. So please type any questions that you have into the chat box. But we'll go ahead. Janet, can you get us started with your numbers as well as anything you have prepared, and then we'll have Ed go next. Thank you.
Hello, everyone. Today, the Rock Island County Health Department is reporting 14 new cases for a total of 1,373. We have 14 in the hospital, and our deaths remain at 30. The temporary testing site at the QCCA Expo Center in Rock Island closed on Sunday, and we did almost 5,000 cases. Anybody who is waiting on test results should still be watching for the phone number that is 888-297. Oh, sorry, I forgot it. Just give me just 1 second here. I thought I had it memorized. It's 888-297-7208. No message will be left because of privacy reasons, but if you call back that number with your name and date of birth, you should be able to receive your test results. That's all I have. Thanks.
In Scott County, the number, as we speak, number of cases in the county is 1,322. Sadly, yesterday, another death of a Scott County resident due to COVID-19 was reported by the Iowa Department of Public Health, bringing the total number of deaths for Scott County to 11. We're deeply saddened by this COVID-related death in our county, and our deepest sympathies are with the individual's family. Resurgence of COVID-19 cases that we've seen over the last month continues to concern us. Unstable, uncontrolled spread of the virus in our community puts us all at risk. Going about our daily lives how we always used to puts us all at risk. We urge all residents to act now to reduce the spread of illness by avoiding large groups, keeping distance between yourself and others, wearing a face covering, and observing public health recommendations if you become ill or if you're told you're a contact to a case of COVID-19. I'd like to welcome back Dr. Louis Katz, the Medical Director for Scott County Health Department. We've asked Dr. Katz to share his perspective with you, what we can expect in the upcoming weeks and the fall if things don't change, and what we can expect if public health recommendations such as social distancing and face coverings are embraced by our community. Dr. Katz.
Thanks. Brooke, can you put up that the first of those 4 slides? I'm going to share with you some of our surveillance activity. You will notice that the total number of cases is higher than what Ed just said, and that's because my curves include all the epidemiologically linked cases that we count in addition to positive tests. So it's explicable and not a major issue. The point I wanted to make here is there's an inflection point in middle and late June that is in perfect, it's perfect timing for the concerns we had in May that reopening was coming too soon. So we basically, the bulk of the most dangerous reopening occurred on or about Memorial Day, and it takes 2 to 3 weeks then for the cases to begin to be diagnosed and reported. So we have no doubt that this is related to reopening more rapidly than many of us would have preferred. Half of our total cases, actually more than half of our total cases, have now occurred in the first 2/3 of July in comparison to April through June. As I said, attributed to reopening and quote unquote bad behavior by adolescents and young adults, late adolescents and young adults. Let me show you the next slide, which is the date of clinical onset of the cases that we're looking at. And this just really shows you very graphically the association of our surge with reopening 2-3 weeks earlier. I couldn't do a better picture. The next is the age distribution of our clinical cases. This is people who were sick, not people who had positive tests. So this is people who were ill and had a positive test, or were ill and had an epidemiologic link to a confirmed case. This doesn't look like the curves that we saw worldwide early in the epidemic or in April, May, and into June in the US. What's changed I can show you on the next slide. And this is the age at clinical onset by month of report. So as you can see, from April on top to July through the 19th, I think. This is up to date through the 19th. I haven't added yesterday's cases yet. You can see that the age distribution is markedly shifted into that 20 age group. And when we do a few simple data manipulations, we see that the median age has fallen from around 50 to under 30 years. And we think this represents failure to social distance by young adults who, A, feel they're invulnerable, B, believe it's important that they tend not to get sick. Although these, again, are clinical onsets, these are people with illness, so you can see that's clearly not true. And C, ignore the fact that they can transmit to people who are at high risk for bad outcomes. So this is really about the failure, particularly in younger age cohorts, to use good sense and follow public health guidelines. Did I have anything more in terms of slides, Brooke? I think that was the last one.
Nope, those were the 4 that you had.
Okay. We're starting to look at the geographic distribution of cases within the county to see if that will give us any insights or flexibility as we begin to discuss school reopening. But that effort is really too early to show you anything. If you look at the European Union, most graphically perhaps Italy, but also Germany, France, and Spain, other areas in the EU, or you look at the Far East, Hong Kong, Korea, South Korea, Singapore, China itself, it's very clear that non-pharmacologic interventions, that is social distancing, appropriate hygiene, and masking, can be highly effective at pushing the curve down. Unfortunately, in the United States, we backed off starting in May, never really flattened the curve effectively. And as I showed you in Scott County, in many, if not most areas of the country now, we're seeing surges that are beginning, particularly in the southern tier of states, to seriously stress the ability to provide care. In the metro area, and specifically on the Iowa side of the river, the number of hospitalizations is dramatically higher than it was in June, but not yet at levels that we think are going to compromise the ability to provide care. But we're watching that very closely, and the infection control people at Genesis and on the Illinois side of the river as well are sharing with us their data, and we look at it pretty much every day. So I think we're okay from the standpoint of the ability to deliver care. That will not be true if, as I believe is the case, the young adults being infected in late June, mid-June, and late June and into July are beginning to transmit to high-risk groups. That data also is not yet mature. I haven't even shared it with Ed and Amy at the health department yet. So I have a deep concern for healthcare capacity over the next 4 weeks. I cannot predict whether our surge is going to end. There's certainly nothing coming from Des Moines that would be highly effective other than what I consider to be inadequate recommendations that people wear masks. As you know, it was proposed to the Scott County Board last week to have a mask mandate, but we've got a number of legal opinions that tell us we can't do that. So we hold out some hope that in Des Moines they'll change their approach and allow counties surging like we are to do things more actively and aggressively. You need only look into the Northeast United States. I would say specifically New York City, Massachusetts, New Hampshire, where significant early activity was seen, and where they have, in fact, attained and maintained low levels of community transmission now for a number of weeks. It can be done with aggressive interventions. We're not there yet, and I'm not sure when we will be. I think certainly my first priority is to be in an epidemic situation in late August where some level of face-to-face education can occur K through 12. Current trends continue. I think that's going to be difficult to justify, but we're still a month away from those. And with appropriate intervention from Des Moines and with appropriate cooperation with common sense, recommendations for social distancing and masking that really haven't changed over the last number of weeks. If the populace decides to adhere, we may get lucky. But right now, I'm very pessimistic as to what degree we'll be able to reopen schools in late August. I don't think I have anything else to say. And certainly willing to take questions at the appropriate time.
Thank you, Dr. Katz. We have had a couple of questions typed in. We encourage anyone on the call from our media partners, if you have questions, please type them in and we will get to those as they come. We did have an initial question that came prior to this. We'll start off first. The question is for Rock Island County, so we'll put this to you, Janet. Could you please provide updated Rock Island County recovery numbers and what's the case count and death count at the Tyson plant in Jocelyn?
The Tyson case count is 163, and the death count, last I knew, was 1. I can confirm that with WVIK if that number is incorrect. As far as recovery data, that is a statewide statistics, and most recently the state has said that it is at 95%. And then how they do that is recovered cases are defined as people with initial positive specimen collection, and then 42 days from that, and anyone who has not died who is considered to be recovered. So some counties that have very, very small case counts have been able to provide very local recovery data, but the fact that we have 1,373 cases, right now we do not have the capacity to report local recovery data, though we are ramping up our contact tracing efforts.
Thank you. The second question that came through, we'll start with Ed for this one. Can you discuss what we know about symptomatic versus asymptomatic individuals that have tested positive? Do we know what the percentages are for those for Scott County?
We know because of our case investigation, our staff reach out to all those who have been reported having a positive PCR test. And when they provide information, that's entered into our records here. Of those for whom we have collected information about whether they've had symptoms and when those symptoms started, 85% of the cases have been symptomatic and 15% asymptomatic.
Yeah, and let me add to that a little bit. New data from CDC trying to estimate actual infection rates versus what we're seeing as case reports suggests that depending on where you are and what the circumstances are, somewhere between half and less than 10% of the cases wind up as reported. So obviously, testing is heavily biased toward people with symptoms. But depending on where you look, there may be anywhere from 2 to 13 times as many infections as there are case reports. And most of those infections that we're missing are missed either because they're asymptomatic or minimally symptomatic. Less commonly, but significantly, because they cannot access testing or care. So clearly, what we see is our case reports are the tip of the iceberg. And you should pay more attention to trends than absolute numbers.
Thank you. I'll just go to the top of the questions that we've received so far. How many tests have been administered in Scott County? I know Ed provided some information on there below on the total number of tests that have taken place. So on that coronavirus.iowa.gov website, there is a section that has assessments, which is related to Test Iowa. However, if you are on the summary information for positive cases and you click on Scott County, it will also give you the total number of tests that have been completed. It looks like there's a couple of different readings on there for our total number of positive cases. So we'll be watching this site to see if it reflects something different by the time we're done here. Another question, perhaps Dr. Katz, you can respond to this one. Can you speak to contact tracing and the importance of testing to trigger contact tracing and how we see that impacting what we're able to do?
Well, yeah, I mean, if we identify a case, however we identify it, symptomatic or asymptomatic, we identify a PCR positive, we then try with great speed to interview them, identify contacts, and we have a standard definition of contacts, and then we ask the first generation contacts to quarantine for appropriate durations, depending on when contact terminated and those sorts of things. So test and trace is critically important, and in fact, much more important than we thought in January and February, before we began to realize how many cases are asymptomatic. So for example, with influenza, because most people are sick when they become infected with influenza, we can do syndromic surveillance. We can count sick people in doctors' offices, in emergency departments, absenteeism from school, those sorts of things, and have a pretty good handle on the scope of things. Now that we realize that COVID-19 has a very high proportion, at least, I suspect, at least half, syndromic surveillance doesn't work very well. There's lots and lots of people out there capable of spreading for several days during their infection who don't come to our attention because they're not ill or not very ill. So contact tracing becomes quite important, and then isolation of cases and self-quarantine of contacts for the appropriate durations. It's very important, and those are the things that work in Europe, in East Asia, and in those areas of the Northeast where they've had successful and fairly sustained control of cases.
Next question, perhaps you can provide anecdotally what you think might be involved with this. How was Scott County able to avoid the early May peak that was seen statewide?
I'm not really sure what we avoided and what we didn't. Our nursing homes did a great job. So there was very little activity in nursing homes. We don't have in the county enormous meat processing operations that contributed to some spiking elsewhere, and luck. Maybe people were more compliant early on with social distancing, and they're fatigued about social distancing now. Not really sure I have a good answer, and like everything in COVID epidemiology, it's probably 6 different things.
And somewhat related, has there been a noticeable
about that?
Sorry about that. Has there been a noticeable change? Has there been a noticeable change in behavior locally? Are we seeing more voluntary masks and as cases have surged, or other types of voluntary requirements that you've noted?
Well, I was in a Hy-Vee briefly and a Home Depot yesterday, and I would estimate about 75% of people were masked. I think regardless of what comes from Des Moines, large businesses and small businesses would not allow people on their private property without a mask. I think that would be incredibly helpful. And avoiding large gatherings. Remember that, for example, the people at Mississippi Valley Fair looked at the data and said this isn't going to be safe and called off their event. So there are lots of things the general population can do, and I particularly encourage private business owners not to allow people on their premises without masking and appropriate distancing, regardless of whether we get a mandate from the state.
Another question, would you please speak to the lag in hospitalizations compared to when positive cases are reported? And then, of course, the number of deaths has not increased dramatically yet. Please address this as well.
Yeah, so those are all lagging indicators of infection. And it's one of the reasons that we pay a lot of attention, not to just the total positive tests, but to the case onsets. We know that people tend to get sick a week after infection. The mean and median incubation period, that is time from acquisition of the virus until you're ill, is 6 or 7 days. So you've got a week lag then before people get sick and get tested and seek care. Then, in order to get sick enough to wind up in the hospital, takes on average with minor symptoms, and some people even feel better on day 3, 4, or 5. They get worse again on days 5, 6, 7, 8, and then wind up progressing in a hospital. That's then at the end of the 2nd week after infection. Once you're in the hospital, ill enough to be in the hospital, the progression from ill enough to get admitted, get into the ICU on the ventilator is another 5 to 7 days, and death long after that. So each of these things after the acquisition of infection is a lagging indicator. In epidemiology, we call it a lagging indicator. The shortest lagging indicator is initial symptoms. So we follow date of onset very closely. Then you seek care, get tested, there's more lag. Then you have to get sick enough to get in, there's lag. And then the ultimate lag is the time from going on a ventilator until you die.
Another question for you. This is related, I think, to what you were discussing earlier with testing. So then it makes less sense for Iowa to start limiting the number of tests, correct? Is the state going to limit testing?
Limiting testing at this point is insane. You want me to spell insane?
Thank you. And do you expect to see an increase in deaths, especially in Scott County?
More cases, more deaths. We've learned a tremendous amount since March. Who will die in July and August is going to be significantly lower than the proportion of people who died in March and April. Also, because we're seeing more infection in younger people, they tend to do better. So I think deaths will increase. I don't think it will be as dramatic as the horror that was seen in New York City during their first part of the first wave. We'll see more deaths. Hopefully, it will be quite few.
Okay, we have this one last question and then we'll be concluding for the day. So we'll go to this and then we'll be done. In Iowa, Dubuque and Scott counties are seeing dramatic increases in positive cases versus early in the pandemic. Is there causation or correlation that can be drawn to them being both Mississippi River counties or sharing borders with other states?
I would look at increases in Illinois to answer that question. Iowa has had very weak interventions from the beginning, and there's a study that was published late May from the University of Iowa looking at the relative number of cases in Iowa and Illinois counties adjacent to each other on each side of the river. And it estimated that if Iowa had used the types of interventions that were mandated in Illinois, there would have been in the range of 200 fewer cases in the border counties. So I think if the border contributes anything, it's our cases being transmitted, swapping over into Illinois. I don't know how to measure it, and I don't know whether Rock Island County has asked the question, but I wonder if how many of their recent young adult cases were people who came to Iowa to go to the bars and party when that was still impossible in Illinois. And whether Janet or anyone from Rock Island County has any insight, I don't know. It's all inference under any circumstances. You can't prove it.
Well, thank you so much for joining us today, Dr. Katz. We really appreciate your insight and the direction that you're providing our communities as we weather through this. Thank you again to Janet and Ed as well for the information that you've shared, and to the media partners that joined us today. We'll go ahead and conclude, and we will be providing you information for our next press briefing. Until that time, watch our websites as well as social media pages for additional information. Thank you.